Um, Greetings, everyone, from the Department of Oral Medicine and Radiology. I am Dr. Yesoda Aniyan. Today, we will be talking about a few of the laboratory investigations, are very crucial for diagnosing disorders. May it range from an abscess, which a patient might be suffering from a dental cause, to other autoimmune or infectious disease standard or confirmatory tests that help us in guiding and for choosing the best management protocol for a patient. From the academic point of view, the lab investigations are divided as three: pre-analytic, analytic, and post-analytic. Pre-analytic tests refer to tests which are done, which help us enable us in reaching a provisional diagnosis. These include some chairside investigations like a dioscopy or a vesicle if we are taking a swab from it. Analytical are those which help us in arriving at a diagnosis. After provisional diagnosis, the investigations one advises. And post-analytical are further confirmatory tests that are done to pinpoint or to accurately prove the possibility of the diagnosis. This can be something like an immunohistochemistry or a PCR test, which are the final stage of testing, beyond which you do not have any other range of testing possible. Another classification from the academic point of view are chairside investigations and laboratory investigations. Chairside investigations are those performed by a dentist in a dental clinic in the dental chair where the patient is seated, and the investigation is done prior to arriving at a provisional diagnosis and can be done in the presence of a patient, even in the absence of a lab or laboratory facilities. They act as a precursor to laboratory investigations. For example, toluidine blue staining for grading the dysplasia, electric pulp testing for evaluating the tooth vitality. Now, laboratory investigations, on the other hand, are significantly higher sensitive and specificity. Higher sensitivity means the ability to pinpoint or the ability to diagnose or the ability to correct the diagnosis that we are giving provisionally from the tests. And specificity refers to how correct our diagnosis is, and it is given a numerical value. For example, a glycated hemoglobin estimation, commonly known as HbA1c, it helps us to evaluate the blood investigation for hemoglobin and the amount of glucose associated with that hemoglobin cell for a time period of approximately 3 months. Similarly, another one is peripheral smear histology, which helps us to evaluate the blood cells, the peripheral blood cells or the white blood cells which are present in a patient, giving us diagnosis from infection to inflammation to even malignancy. The other kinds of tests are screening tests and diagnostic tests. Screening tests, as the name suggests, they are very broad range tests, which just allow us to reach a broad range of classification. For example, we are able to decide whether the disease the patient is suffering from is of an inflammatory cause, or whether it is an autoimmune condition, or whether it is possibly a malignancy, but it doesn't exactly pinpoint or give an accurate name or an accurate diagnosis. Neither does it give the exact management protocol for it, because obviously that would be dependent on the diagnosis. It helps us to narrow down the provisional diagnosis, and they are useful in case of a large sample size at risk, and they are generally cheaper. For example, blood glucose estimation for screening of diabetes, where it is a very broad range testing. It does not tell the patient, the diagnostician for how long the patient has been suffering from that disorder, nor whether the patient is on medication, etc. Nothing can be derived from just looking, but we are aware, and it does help diagnostician understand that currently the patient's blood glucose levels are skewed. The other examples are hematocrit values for anemia, which helps one diagnose whether the patient has anemia or lower levels of hemoglobin or not. But it does not help a diagnostician understand what is that anemia stemming from, or what is the etiology behind. Is it a dietary deficiency? Is it another level of malignancy, or is it any other hematological disorder that is manifesting as anemia? VDRL test for syphilis is another example for screening tests. Diagnostic tests, on the other hand, are those which are 100% specific. They are generally gold standards for those particular diseases. They are useful in symptomatic individuals to establish the diagnosis, or asymptomatic individuals with positive screening tests, and they generally tend to be on the more expensive side. Examples are the glycated hemoglobin estimation, or your HbA1c, your oral glucose tolerance test, which is very commonly done during postprandially to evaluate the blood glucose tolerance, and peripheral smear histology. Finally, the final classification being based on the medium from which we are evaluating or reaching a diagnosis: hematology, which usually entails blood-related evaluations, where a sample of blood is drawn and the various biochemical tests are performed in the laboratory. A urine analysis, where urine is collected from the patient and the evaluation is done for its various biochemical parameters. Biochemistry, it can be both any of the the body fluids of the individual which is collected, and the various chemical evaluation from the potassium, sodium, zinc, and various other organic components are checked for, as well as inorganic ones. Immunology, where the specific immunoglobulin levels or the IgA response, etc., is checked for, or even the huge cells like lymphocytes, neutrophils, etc., are checked for. Cytopathology, which usually involves collecting a tissue sample from the patient, or it can be a swab from the patient, and the various microorganisms within that sample is checked for. And lastly, histopathology, where a tissue sample is used by biopsy from the patient, and the evaluation is done. Basic lab investigations involved in dentistry. It entails this that are available. Thank you.